Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is Prashant Kumar Sinha and with me is Renuka RS bringing glimpses of the major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment and more. Prime Minister Narendra Modi reiterates government's commitment to provide COVID-19 vaccine to everyone free of cost. Vaccination coverage to be expanded from Monday. Indian Embassy in Beijing to organize International Day of Yoga celebrations on Sunday. Voting underway in Iran for presidential elections 2021. European Union lifts travel restrictions for U.S. tourists. Antonio Guterres appointed as Secretary General for second term. Prasad Bharati Audience Research releases news on AIR radio live stream global rankings. Rupee appreciates 22 paise against US currency. And in football, Sweden defeats Slovakia 1-0 in the Euro Cup. As many states are relaxing lockdown norms, we advise our listeners not to lower their guard as the COVID-19 pandemic remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow the 4 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene, and get vaccinated. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075. Now the news in detail. Prime Minister Narendra Modi has said that the government is committed to provide free-of-cost COVID-19 vaccines to everyone. He said vaccination coverage will be expanded from the upcoming 21st of June.
21 जून से जो टीकाकरण अभियान शुरू हो रहा है, उससे जुड़ी अनेक गाइडलाइंस जारी की गई है। अब 18 साल से ऊपर के साथियों को वही सुविधा मिलेगी जो अभी तक 45 साल से ऊपर के हमारे महानुभावों को मिल रही थी। केंद्र सरकार हर देशवासी को मुफ्त टीका लगाने के लिए प्रतिबद्ध है।
Talking about the changing nature of the coronavirus and the country's resilience to deal with this infectious disease, Mr. Modi said COVID-19 pandemic has helped in developing a robust medical infrastructure in the country. He said this pandemic has helped the government, science, society, institutions and individuals to expand their capabilities. He stressed on creating medical infrastructure in the country to deal with the growing challenge of mutant coronavirus. Prime Minister Narendra Modi today launched a customized crash course program for COVID-19 frontline workers. With the launch program in 111 training centers spread over 26 states has commenced. The program aims to skill and upskill over 1 lakh COVID warriors across the country, and the training will be completed in 2 to 3 months. Highlighting the importance of this skill development program, Mr. Modi said unprecedented efforts are being made to create a large pool of trained healthcare workers in the country.
इन प्रयासों के बीच एक स्किल्ड मैन पावर का बड़ा पूल होना, उस पूल में नए लोग जुड़ते रहना, ये भी उतना ही जरूरी है। इसी को देखते हुए कोरोना से लड़ रही वर्तमान फोर्स को सपोर्ट करने के लिए देश में करीब 1 लाख युवाओं को ट्रेन करने का लक्ष्य रखा गया है। ये कोर्स 2-3 महीने में ही पूरा हो जाएगा, इसलिए ये लोग तुरंत काम के लिए उपलब्ध भी हो जाएंगे और एक ट्रेंड सहायक के रूप में वर्तमान व्यवस्था को काफी कुछ सहायता देंगे, उनका बोझ हल्का करेंगे।
In today's hotspot section, we bring you an exclusive interview with Atul Kumar Tiwari, Additional Secretary, Ministry of Skill Development and Entrepreneurship on customized crash course skill development program for COVID-19 frontline workers.
Prime Minister Narendra Modi today said that India needs to be prepared to combat the new challenges that are being posed by the virus, and in working towards this, one of the very important things is our frontline workers. He has said that we are preparing 1 lakh frontline workers for the country. We have with us Mr. Tiwari. Can you tell us a little bit about Prime Minister's announcement today? What is being done to prepare this workforce, and what will be the role of the Skill Development Ministry in making sure that this happens?
everybody knows that the COVID crisis is a global phenomenon and every country has been badly affected by that. And during this time, our health services have been working overtime, our doctors and nurses. Prime Minister even mentioned about the Anganwadi workers and the ANMs and ASHA workers also who are doing such a great work in the rural areas. So the basic intention of this program is that we keep ready the human resources required for healthcare and how do we train them in a most efficient manner so that trained, skilled healthcare frontline workers are available in our health services, diagnostic centers, etc. So that whenever the next crisis starts, at least we will not have a shortage of the manpower. That was the basic intention behind this customized crash course on COVID-19 frontline health workers.
Customized crash course that has been designed. It is part of the Pradhan Mantri Kaushal Vikas Yojana. What is the total amount that government will spend on this? And what are the kind of training centers that we will have? What are the job roles that will be covered by this scheme? Can you tell us a little bit about it?
This customized crash course is being taken up under Pradhan Mantri Kaushal Vikas Yojana. And as it is, we do a training in so many diverse job roles. But because our country needs strengthening of the healthcare system, that's why we are concentrating on these job roles. Now, what kind of job roles are required, we are not competent. So we had a detailed discussion with the Healthcare Sector Skill Council, which is headed by very eminent doctors. Dr. Naresh Tihan is the chairman. Then we have Dr. Devi Shetty. We have Dr. Guleria. So all the eminent doctors and the hospitals, we consulted them and said that what is that you require? So they identified 6 job roles like GDA, home health assistant, emergency medical technical assistant, then sample taking, like that 6 jobs roles were decided. Then we asked them that we wanted them to be made quickly. So generally the trainings are done in 3 months. So what we did was that we customized crash course, which is for 21 days to 27 days, followed by the on-the-job training. So what would happen is that the candidates, when they get into that, depending upon their qualification, for example, for the emergency medical technical assistant, they require something higher qualification than the GDA or the home health assistant. They will be first assessed after the theoretical course in our PMKVY Pradhan Mantri Kaushal Kendras. Then they will be made certified fit to be deployed in the healthcare diagnostic centers. There they will be undergo 3 months of on-the-job training. After that, again, they will be assessed and then certified. So the idea was that we give them basic theoretical training and then expose them in a real-life situation so that their skill in working in the real atmosphere would further improve. And the budget for this is around 273 crores, which we anticipated for around 1 lakh such healthcare workers, which includes 90,000 of the fresh skilling and 10,000 for the re-skilling. The re-skilling is important because for last so many years, PMKY has done skilling for so many youth, and we assume that around 10,000 of them, we have been talking to them, 10,000 of them would require re-skilling so that after 1 week of re-skilling, immediately they can be deployed to the health services as well.
Who are the people who can take benefit of this scheme, and how can they enroll for it if they want to get trained in any of these different 6 job roles, for instance, that you've talked about?
As Honorable Prime Minister also mentioned, we are doing a demand-driven method. So in our Skill India app, we asked all the state governments and district administrations to give their demands. And we have a thing called District Skill Committee. They decide, which is headed by the local officers, collectors, some places, and serviced by the district level officers, the skilling, etc. So they've had to analyze their district level situation and suggest to us what would be their requirement. And based on the requirement, the mobilization is also done by them. Then we have our training providers. They also help the district skilling committee to mobilize. And as you know, for all such skillings, there had to be NSQF, National Skilling Qualification Framework, approved. So in that, we took the emergency approval of the NCVET. And there the entry-level qualifications are given like 10th standard, 12th standards, or having science or something like that. So whoever qualifies that and above a certain age limit, which is quite evident they have to be adult, they can apply for that and then they can get themselves skilled and trained.
As you said, demand driven. So if the demand is more, then you will train more people as well, I understand.
We have limitations of certainly the resources are limited. We also have limitations in terms of the training centers available. But we will try to cover as many districts as possible and keeping the 1 lakh target which we have set for ourselves. And if the demand increases or the facilities are cohere with our requirement, then certainly we can consider later for more people.
Mr. Tiwari, this whole announcement around the customized crash course program and ramping up of the frontline workers, it's coming at a time when India is coming out of a very, very horrible second wave. There is fear of third wave. So how do you see these frontline workers getting utilized? Because there's parallelly also one of the world's biggest vaccination drives that are going on. How do you see this workforce that will be trained getting deployed on ground?
Here again, I will like to respectfully quote what Honorable Prime Minister said in his address today, was that he referred to this as a kind of Mahaviyaan, is a big campaign where we want to increase the manpower pool of skilled people by new young people. And what is happening is that because of the corona, our health services are under unprecedented stress. They are overstretched everywhere in every state or district. So while the government is doing everything it can for providing the capital infrastructure in terms of oxygen plants and having more hospitals, etc., we also need to look into the aspect of the people who would be working on these health services. So since the demand is going to burgeon and there is an increased emphasis on the health services these days, so we'd also expect that the health services would also increase in the country in all our other districts. So we need the manpower for that. And that is why we have taken this focused approach to have these 6 job roles, which has been, as I told you earlier, has been approved and recommended by the experts in the health sector skill council. Now, these people will, first of all, they will add to the skilled manpower available. Second, when they are deployed into the health services, the overstretched our doctors and nurses and paramedical staff who are doing a lot of routine works, they will also be relieved. And the burden on them would decrease, and some of the burden will be taken up by these young people. And the trained medical professionals, doctors and nurses, they will be able to take better care of the patients rather than doing the routine work. For example, all the 6 job roles, ma'am, the medical record keeping is also included. So you can imagine that the treatment itself is not enough. Sometimes we also have to put the people back to their feet, and this will be very useful. Then there's something called phlebotomist, which is the sample taking. So they will be deployed in diagnostic centers. Then we have the EMTA who will work with the ambulances and try to work with the oxygen plants, nebulizers, and other. So resource pool. At the same time, they're also relieving the pressure on the trained, medically certified manpower as well. So on both these fronts, they will help us in meet the challenges of the corona, whichever the wave comes, because as Prime Minister was saying, the virus is mutating and it can take many other forms. And until we come to a certain level of vaccination, this threat will always remain. So we have to be ready for such eventualities. And that eventuality is one of the ways, in our very humble way in the skilled ministry, we are trying to add to the skilled frontline healthcare workers.
So this resource pool that you will create, will it be absorbed by government facilities or also by private facilities? And how long is this training program as well? So we can get an idea as to when will this workforce be ready to be utilized?
Today, we have started this around 100 training centers in 26 states and UTs, and which will take almost 6,000 young people will be trained. We are going to take it over the phases. As you know, there are COVID-like the lockdown situation in many parts of the country. Then we also have to see the readiness of the training partners also to be available. Infrastructure also has to be available. And as our Honorable Prime Minister was saying, that these people are going to deal with the people, their health, etc. So they have to be properly trained. So depending upon those limitations, we are trying to talk to the state governments and district authorities, opening up the training centers. For example, today is also many parts of the country are closed, but we took a special permission from the chief secretaries and the district magistrates to open the centers so that they can allow these trainings to continue and the movement passes for the trainers and the trainees, etc., etc. So our idea is that we'll go ahead and by July end at that time, we'll be able to ramp up all our infrastructure and our efforts so that we have the people under the scaling process.
So Tiwari, you mentioned how there is obviously a limit to the resources you have. There is a certain number of training centers and obviously a certain number of trainers also that you have. Is there a big challenge in this area, and do you have any estimate of the kind of demand that you would see for this crash course that is being launched?
See, we set up a target of 1 lakh, and then, as I told you, we requested the state governments to give their demand, UTs to give their demand. And you will be surprised to know we got a demand within 3 weeks, 2,80,000 demands. So there is a demand there. Second point is that this is the district skilling committee headed by the district commissioner, etc., who are the local authorities, district administration. We have left it to them where they will be trained or where they will absorb. And since the training, as you wanted to know the timing, is around 3 weeks of theoretical training and 3 months of on-the-job training and assessment. So we assume that because the trainings will be very, very useful and worthwhile, where theoretical as well as practical trainings are combined and then the assessments are being given, we're also trying to increase our monitoring processes, etc. So as a result, the quality of the training will be very realistic, very, very high.
The Indian Embassy in Beijing to celebrate International Day of Yoga on 20th of June. The Indian Embassy in Beijing will organize International Day of Yoga celebrations on Sunday. Around 500 people will participate in the event. The yoga sessions, which include group yoga session as per Common Yoga Protocol of Government of India, and advanced yoga demonstrations will be led by leading Indian yoga guru in China, Mohan Bhandari. Mohan Bhandari is the first Indian yoga guru who came to China from Rishikesh in 2003 and established his yoga institute, Yogi Yoga, which is the largest in China at present. In an exclusive talk with Prasar Bharati correspondent in Beijing, Mr. Bhandari spoke about yoga's popularity in China and International Day of Yoga.
Every household now know about yoga, and each and every family there are some people who are practicing yoga. And एक बहुत अच्छी चीज है चाइना में, जो जवान लोग हैं 20 से 30 साल के बीच में, उनके बीच में योग बहुत ज्यादा पॉपुलर है, और उसमें जो अधिकतर जो पॉपुलेशन है वो फीमेल की है. तो मुझे हमेशा ये लगता है कि अगर माँ कुछ करती है तो बच्चे उसको हमेशा फॉलो करते हैं. तो इन नेक्स्ट generation of China, they will be born yogi, and from childhood they will love yoga and they will practice yoga.
Voting is underway in Iran for the presidential election 2021, with nearly 60 million Iranians eligible to vote for one of 4 candidates running. Polls opened across the country at 7 a.m. local time on Friday and will run until 5 p.m. According to state-run broadcaster, voting can be extended until 12 a.m. on Saturday and for 2 more hours then if necessary. Officials have stressed that health protocols will be strictly observed in all polling stations amid the COVID-19 pandemic. More than 72,000 polling stations set up countrywide, according to the figures released by election officials. Around 3.5 lakh Iranian expatriates are also eligible to join the vote in 234 polling stations set up by the country's diplomatic missions in various world countries. This time the presidential election dominated by a hard-line protege of Supreme Leader Ayatollah Ali Khamenei after authorities disqualify nearly all of his strongest competition, leading to what appeared to be a low turnout fueled by apathy and calls for a boycott. Opinion polling by state-linked organizations along with analysts indicate that Judiciary Chief Ibrahim Raisi, who is already under U.S. sanctions, was the front-runner in a field of just 4 candidates. Former central bank chief Abdullah Nasser Hemati is running as the race's moderate candidate but hasn't inspired the same support as outgoing President Hassan Rouhani, who is termed limited from seeking the office again. Dissidents and some reformists have called for a boycott, saying the barring of several contenders has removed any genuine competition. The elections come at a time of widespread discontent among Iranians over economic hardships. However, there is a widespread apathy among voters after 3 years of crippling sanctions reinstated by the U.S. when it abandoned a nuclear deal between world powers and Iran.
U.S. travelers will finally be allowed to visit Europe again this summer. The European Union's governing body has recommended that the bloc lift restrictions on non-essential travel from 14 countries, including the U.S., a move that would allow visitors from these destinations to vacation in Europe far more easily. In a statement announced on Friday, the European Council said member states should gradually lift the travel restrictions at external borders for residents of the following countries: Albania, Australia, Israel, Japan, Lebanon, New Zealand, Republic of North Macedonia, Rwanda, Serbia, Singapore, South Korea, Thailand, USA and China, subject to confirmation of reciprocity. The UK was noticeably absent from the list, which is to be reviewed every 2 weeks. Italy is introducing mandatory testing and a 5-day quarantine for visitors from Britain, Health Minister Roberto Speranza said on Friday, as concerns grow over the spread of a highly contagious coronavirus variant. At the same time, Italy will lift curbs on travellers from the US, Canada, Japan and other European Union states if they have a green pass showing that they are vaccinated or recently tested negative, the minister wrote on Facebook. This is All India Radio giving you the world news.
The centre is disseminating awareness of national helpline numbers for the benefit of citizens during the COVID-19 pandemic. The helpline number of the Health and Family Welfare Ministry is 1075. The child helpline number is 1098. For senior citizens of Delhi, Karnataka, Madhya Pradesh, Rajasthan, Tamil Nadu, Telangana, Uttar Pradesh and Uttarakhand, the helpline number is 14567. The helpline number of National Institute of Mental Health and Neurosciences, NIMHANS, for psychological support is 08046110007. Ayush COVID-19 counselling helpline number is 14443 and MyGov WhatsApp help desk number is 9013151515.
Welcome back to the World News. UN Secretary General Antonio Guterres was sworn in Friday for a second term as head of the world body, promising to draw on the lessons of the deadly COVID-19 pandemic. Our greatest challenge, and which is at the same time our greatest opportunity, is to use this crisis to turn the tide, pivot towards a world that learns lessons, the former Portuguese Prime Minister said as the General Assembly reappointed him for the 2022 term. In office since 2017, Guterres promised to act independently of member states and organizations during the swearing-in ceremony attended by Portuguese President Marcelo Rebelo de Sousa, the first head of the state to set foot in the United Nations building for more than a year because of the pandemic. Indian naval ship Trikand, mission deployed for anti-piracy operations, is participating in the maiden IN-4 joint naval exercise in the Gulf of Aden. A total of 5 warships from 4 navies are participating in the 2-day exercise, which commenced today. Other warships include Italian Navy ship ITS Carabiniere, Spanish Navy ship ESPS Navarra, and 2 French Navy ship FS Tonnerre and FS Ferrocove.
The U.S. will officially recognize Juneteenth, which commemorates the end of slavery in America, as a federal holiday after President Joe Biden signed a bill into law. At a jubilant White House ceremony, the president emphasized the need for the U.S. to reckon with its history, even when that history is shameful. Just before signing the bill, President Biden said, "I've only been president for several months, but I think this will go down for me as one of the greatest honors I will have had as president." Juneteenth commemorates the day in 1865 when news of the Emancipation Proclamation reached the people of Galveston, Texas, freeing slaves in the last rebel state. Abraham Lincoln had signed the Emancipation Proclamation in 1863, but the proclamation wasn't enforced in Galveston until federal soldiers read it out on the 19th of June 1865. North Korean leader Kim Jong-un has said his country needs to prepare for both dialogue and confrontation with the U.S. and especially to get fully prepared for confrontation. This marks the first time Mr. Kim has directly commented on President Joe Biden's administration. North Korea had earlier snubbed efforts by the new U.S. government to establish diplomatic communication. The U.S. has been calling for North Korea to give up its nuclear weapons.
Prasar Bharati Audience Research has released News on AIR Radio livestream global rankings. In a major development in these new rankings, United States has displaced France as the top country in the world on the basis of popularity on News on AIR app in these countries. France stands now at number 2 and Japan is the new entrant in the top 10 countries category. The Ministry of Information and Broadcasting in a statement said that these rankings are based on fortnightly data from the 1st of June to 15th of June 2021. This data does not include India. In Euro football, the Netherlands have qualified for the last 16 after beating Austria 2-0 at the Johan Cruyff Arena in Amsterdam. Memphis Depay scored a penalty in the 11th minute to give the Netherlands the lead in the first half. Then Denzel Dumfries scored his second goal of Euro 2020 to make it 2-0. Dutch held on to the lead to qualify for the next stage. In another encounter at St. Petersburg tonight, Sweden beat Slovakia 1-0.
With less than 36 days remaining for the start of the Tokyo Olympics, All India Radio brings a special series on India's medal prospects at the sporting extravaganza. Today we will talk about India's hope in the sailing. Vishnu Sarvanan.
Sailor Vishnu Sarvanan has brought India immense pride by qualifying for the Tokyo Olympics. In an exclusive interview with AIR News, Vishnu describes his journey of sailing.
जब मैं 9 साल का था तब सेलिंग स्टार्ट किया था, तभी से मुझे बहुत अच्छा लगा क्योंकि ये बहुत करीब है नेचर से, जैसे फ्लो के साथ सेल करना और ये सब मुझे बहुत अच्छा लगा.
The Government of India's TOPS scheme supported Vishnu in his preparation. Presently, Vishnu is in Malta for his final training before Olympic.
So we chose this venue Malta and I've been training here since the Olympic cycle 2018.
The entire country comes together in wishing that Vishnu Sarvanan makes a giant leap to the top of the podium at the Tokyo Olympics. Siddharth Singh, Sports Desk.
In men's cricket, the day one of the inaugural World Test Championship WTC final between India and New Zealand was abandoned without a ball being bowled at the Rose Bowl Stadium, Southampton, due to rain. Earlier, rain and a soggy outfield delayed the toss and washed out the opening session today.
The Sensex and the Nifty today ended almost flat amid weak cues from global equity markets. The rupee appreciated 22 paise against the US currency and Brent crude prices fell below $73 per barrel mark. A report from the Business World.
Sensex at the Bombay Stock Exchange gained 21 points, or 0.04% to close at 52,344. Divergently, Nifty at the National Stock Exchange fell 8 points, or 0.05% to settle at 15,683. In global equity markets, Asian shares traded mixed after the US Federal Reserve projected higher interest rates in 2023. Hong Kong's Hang Seng rose 0.9%, Singapore's Straits Times Index gained 0.2%, and South Korea's Kospi added 0.1%. China's Shanghai Composite Index finished almost flat, while Japan's Nikkei 225 lost 0.2%. European shares were down in intraday trade. Crude oil prices fell for a second straight session. In intraday trade, Brent crude prices were trading around $72.60 per barrel. Back home, gold prices gained 255 rupees at the multi-commodity exchange for August contracts. Gold was trading at 47,215 rupees per 10 grams. Silver prices also climbed 1,100 rupees to trade around 68,700 rupees per kilogram for July contracts when reports last came in. And the rupee appreciated by 22 paise to close at 73 rupees and 86 paise against the US dollar. The domestic unit managed to bounce back modestly after falling to trade beyond 74 rupees per dollar mark, even as the US currency continued its strengthening rally. Arjun Chaudhary for World News, All India Radio.
A quick look at the headlines once again. Prime Minister Narendra Modi reiterates government's commitment to provide COVID-19 vaccine to everyone free of cost. Vaccination coverage to be expanded from Monday. Indian Embassy in Beijing to organize International Day of Yoga celebrations on Sunday. Voting underway in Iran for presidential elections 2021. European Union lifts travel restrictions for US tourists. Antonio Guterres appointed as Secretary General for second term. And in football, Sweden defeats Slovakia 1-0 in the Euro Cup. 151st birth anniversary of Mahatma Gandhi. Before we end, let's listen to his favorite bhajan, Vaishnavajan, by artists from Finland. And with that, we end this bulletin. We'll be back at the same time tomorrow with the next edition of World News.